Hi, my name is Dr. Chad Watkins with Watkins Foot and Ankle Clinic in Leesburg, Florida. And today I wanted to talk about what is a podiatrist. That's a common question that I get from a lot of patients. They don't understand the difference of a podiatrist, which is a doctor of podiatric medicine, and an MD, which is just a regular doctor, or a DO, which is a doctor of osteopathic medicine. So as far as what a podiatrist is it's a physician that deals with the lower extremity or the lower leg. So often people think of us as foot and ankle doctors or physicians. Basically, as far as our educational background, we'll have gone to undergraduate school, so 4 years of regular college, and then we do 4 years of podiatry school. Now, the difference between us and an MD or a DO is basically when we get to our 3rd and 4th year, after we've done 2 years in podiatry of book work, we then start going to the clinic setting, just like a MD does or a doctor of osteopathic medicine and a DO does. But when we go to our rotations, we start focusing on the lower leg and the foot right away. Now, we'll still do rotations in general surgery and emergency medicine and things of that nature. But we start focusing on our specialty, on our field of study per se, which is the foot and ankle, whereas with a regular doctor, they have to focus on everything. They focus on the heart, they focus on the musculoskeletal system, they focus on the intestines, they focus on the ear, nose, throat. So when you think of your regular doctor, you can think of how usually there's specialists, and then you'll have your primary care physician that deals with everything. Well, although we're taught about everything in the first 2 years, and we do some rotations dealing with all of the other fields, we focus mostly on the foot and ankle. So we get an in-depth knowledge when it comes to the foot and ankles, and like to think of ourselves as the experts when it comes to lower extremity anatomy. Several conditions that we deal with are bunions, hammer toes, ankle sprains, ankle fractures, and all sorts of things. After we go to podiatry school, we then do a residency, and now everyone does a 3-year residency in order to make it standardized. And the first year is kind of like the internship that an MD will do, where basically you do your rotations, once again, through emergency medicine, general surgery, internal medicine, infectious disease. And so you do these rotations for 12 months, and then you basically go into your surgery, and then you'll usually do like 2 years of surgery when you're doing a 3-year surgical program. As far as with an MD or a DO, essentially what they'll do is basically 1-year internship, and then they do their residency. When you look at a foot and ankle orthopedic surgeon, they'll do their internship, then they'll do their residency, and then they'll go for what's called a fellowship. And a fellowship is basically where they get intensive training in the foot and ankle, and they'll do that for a year or 2, and they'll try to get their training specifically in the foot and ankle, because when you think of a foot and ankle orthopedist, when you're doing your residency, you're going to be doing very few foot cases. You deal mostly with knee surgery, hip surgery, broken arms, elbows, and everything that a general orthopedist will deal with, but you don't deal specifically with the foot and ankle. So that's why they go and do a fellowship, and they are highly trained and well trained as well when it comes to foot and ankle orthopedic surgeons, but that's the difference between us. Although they may have more years of residency and they also have their fellowship when it comes to the actual training and surgical training of the foot and ankle. It's very close and very similar and equivalent. So that's basically the difference as far as with podiatrists and MDs or DOs, and basically as far as the difference between MDs and DOs, that's kind of different discussion on a different topic later on if you wanted, where we talk about the osteopathic approach to medicine and the approach from an MD perspective. But podiatrists, we deal with foot and ankle issues, all sorts of things. Can be simple things from corns, calluses, ingrown nails, to more complex issues as far as ankle fractures, foot reconstruction. And it really depends on the type of surgical program you had and training, and that really is what sets us apart. And I tell anyone, if you're looking for a podiatrist, you really want to get a board certified podiatrist, because they've gone up above and beyond what they need to show that they are competent and qualified and have had the training that they need. So if you're looking for a podiatrist in the Leesburg area or Central Florida area, give us a call at Watkins Foot and Ankle Clinic, 352-805-4317. Thank you very much. Bye.